The following is an uncut interview with Dr. Olajide Williams. He's founder of the Hip Hop Public Health Collective, and he has a lot to say about what he learned from trying to prevent strokes that is critical if we're ever going to get everyone vaccinated against the coronavirus. Here's that full uncut interview between Laura Flanders and Dr. Olajide Williams.
What brought you to the work you're doing today, Jide?
My research background is in public health. I'm a health disparities researcher. I've spent the large part of my career on the faculty at Columbia doing work in communities of color, particularly Black communities. One of the great challenges that has been a persistent and almost refractory problem within Black communities is the ability of public health campaigns and public health messages to sufficiently penetrate these communities to a degree that it actually informs, empowers, and motivates behavior change. And part of the reason is related to trust, but another big part of the reason that exacerbates the trust deficit is the inability to really speak the languages of those particular communities.
And so talk a bit about what some of those structural barriers are.
Sure. So one of the first things we need to consider is the socioeconomic context in which many of these communities exist. And that is severe poverty, the vast majority living, way below the poverty line. And with that comes all the other challenges of poverty related to access, insurance, coverage, related to education and literacy levels. All of these factors really serve to really marginalize communities from public health campaigns, public health messages, and even healthcare itself. And then once you add on top of that the issue of structural racism, Laura, you're dealing with a quagmire of challenges.
So give us an example from your work. I mean, your expertise is strokes. How have these barriers come up in your public information work around heart disease?
So I'll just give you a specific problem that I encountered and the way I solved that problem through public health. So as a stroke expert, we have a treatment for stroke that's several treatments now actually, but there's a treatment called TPA. It's a clot busting medication, but it needs to be administered within 4.5 hours of the patient's arrival. There are other medications that we can give, that we can extend that window up to 6 hours in many cases. But again, a lot of these stroke treatments are time dependent. So for a time dependent treatment, you need an individual to arrive within that time window in order to become eligible for that treatment. So what we see in certain communities is tragic delays to care seeking, to help seeking, related to one, a failure to recognize the symptoms as the symptoms, recognize them as urgent, recognize them as dangerous, recognize them as treatable, recognize them as preventable. And then there's the trust of the medical system. They might not want to seek care in a timely manner because they want to speak to a religious leader first, a pastor first, a trusted source in the community first. They just might not even believe in medical treatments and solutions for that problem. So a lot of these problems are driving the gap that we see between certain communities receiving timely treatments and certain communities not being treated at all. And what does that mean? That means that those communities who have the highest risk of stroke are the least likely to receive that life-saving treatment. So what I did was that just recognizing that as a specific targetable problem, I just decided to address symptom recognition, motivation to seek medical care as a way to address this gap. Now, symptom recognition sounds simple, but it's quite complex because you're dealing with a low literacy population in many regards when it comes to health literacy. So you have to target symptom recognition in a culturally tailored manner. You have to target motivation to seek help, and that requires breaking the trust barrier and making sure that you deliver that information in a way that inspires confidence and trust. And that means understanding the message, understanding the messenger, and the roles that those two play in building trust. We did that with stroke, Laura, and we saw that we were able to increase the percentages of people from these communities that were receiving these treatments, that were seeking care for these treatments, simply through a public health intervention.
You've already laid out a very complex set of challenges, but I want to add one more before we get to some of your solutions. And that is, when it comes to symptom recognition, I'm reminded of a moment where a dear friend of mine, a woman in her 60s at that point, late 60s, was having terrible coughing and, was having what she thought was a chest problem. She had a history of emphysema. We rush her into the hospital. They mess around a long time checking her chest. And then they say, no, we're having you go and do a cardio heart scan. And she needed a quintuple bypass. And afterwards, she was told, well, she said, I didn't experience the pain down my arm, all the stuff that they say, is a sign of a stroke. And they said, oh, no, that's the male signs. Women have atypical symptoms. Now, women, I don't need to remind you, are the majority of people. So it is important that the symptoms we're informed about reflect our actual experience, that the science is right too, right?
Absolutely. And you used a wonderful example to really illustrate the point. And that's why it's important to make sure that there is what we call audience segmentation in the messages that we deliver. We have to recognize that we're not dealing with a monolithic group. We're dealing with a diverse group within which certain symptoms might express themselves differently. And so the messaging has to take that into consideration. And so, as you rightly point out, Laura, the message design is often treated with less rigor than the other components of medical care. And that's often the rate limiting step to getting people to buy into whatever it is you're trying to
But isn't it also true that sometimes the science is just plain wrong? They never studied women in a huge array of diseases.
And that's another issue. That's a big issue, because when we look at clinical trials, you have, and I'm, just like the current COVID vaccine trial, we want to know who is in the trial, what percentage of people with vulnerable illnesses, how many had diabetes, hypertension, how many were old, how many were young, who were the women, people of color. We want to see what the representation that was reflected in the clinical trial, because if you have no women in it, for example, you can't say that this is going to be safe if given to women. And so the devil's in the details, and understanding who makes it into these clinical trials has a direct effect on whether those groups are either going to benefit from the trial or whether they're even going to want to participate in receiving the treatment.
Or more importantly, or as importantly, if the drug is actually effective.
And that's the key, if the drug is effective. If you don't sample people over 65, and you can't, with any degree of confidence, say that the drug is going to be effective in people over the age of 65. And this is where the science comes in. And this is where understanding the scientific design and having external independent groups evaluate the science. And that's why sometimes you see press releases of how wonderfully successful a particular treatment is, but it's not yet made it into a peer-reviewed journal. And when it's submitted for peer review, the folks reviewing the article and the science say, hey, wait a minute, there's a flaw here. We need to see more data to really understand whether this is a real flaw or not a real flaw. And so the science and the independent peer review is critically important.
And the journalism, just to take a second, needs to be a little bit more careful. In the discussion, I remember, of the Pfizer announcement, we were hearing what was purporting to be public health information that was actually a kind of corporate press release.
Exactly my point. The announcement, while we were all very excited about it, it's a sigh of relief that we do have something coming. We have to proceed cautiously until we see the unblinded data.
So let's talk about COVID-19. I know you're watching the studies, you're watching the disease itself, the treatment, the communications, the messaging that you've talked about. How would you say we in the US are doing? And then my next question is, anybody out of the US doing it better?
I don't think we're doing it well at all. I mean, I think that we know that we're leading the world when it comes to death rates per capita. We've exceeded 10 million infections, but the tragedy is that we do know that these infections translate into death, and we're approaching 250,000 Americans who will have died from this disease. So I would say we're not doing very well. Anyone that claims we're doing well is suffering from major delusions. We are not doing well. And it's a tragedy because the United States is the bastion of medical discovery. You know, the great land of medical advancement. And for us to be leading the way in death rates is appalling. It's
and in
atrocious.
terms of communications, messaging, lining up for the distribution of a vaccine, if vaccine there be, you're in exactly that field. Have you been consulted?
Well, no, not formally consulted, but whenever I have the opportunity to speak about the importance of cultural adaptation, cultural training, cultural tailoring, the importance of message science, the importance of community galvanization, the importance of trust. I've been sounding the horn about these issues for a long time now, and I'm concerned that if we do not get this right, we're not going to defeat the vaccine hesitancy surrounding this virus. And we're going to find that we're going to have great inequity, great disparities persist because they don't trust the process. They don't believe the science, and no one has tried to penetrate their minds in a way that they trust and in a way that they can embrace. And that is what I'm most concerned about as we move forward with vaccine distribution. And that's why it's important to have a rights-based approach to vaccine distribution.
So let's look at one of the videos your Hip Hop Public Health Project distributes and set it up for us a little bit. I think the one we're going to play is called 20 Seconds or More.
Absolutely. One of the things that I realized just at the height of the pandemic as it hit New York City, actually, it was around March. We had a case in New Rochelle, I believe, and the hospital was one of our affiliated hospitals, Lawrence Hospitals. We were receiving transfers at New York Presbyterian, Columbia, where I am. And I remember just being very, very concerned. Whenever I went into a patient's room, I would wear my mask, my gloves, I'd wash my hands before and after. And I realized that to defeat an infection, especially an infection where there is no treatment, an infection that's highly contagious, there are some basic things that we need to do. Hand washing, we know from the work that we do with flu and flu virus, for example, and respiratory viruses, we know that hand washing can reduce infection rates by as much as 21%. And we know that that simple act of washing your hands in combination with other basic preventative factors can really help to mitigate the spread of the disease, prevent it from becoming the wildfire that it became in this country. And so I remember asking myself, how do I design a resource that could help spread that message in a way that has the likelihood of being listened to and being accepted in the communities that I knew, even back then, were going to be hit the hardest by the virus? And at a Hip Hop Public Health, we've been working with the power of music for many years now. Music is one of the most powerful and yet underutilized resources for public health communication, for public health interventions. As a neurologist, I know music's effects on the brain. It improves learning, improves your mood. It really augments, our memories. And it has so many powerful effects on the brain that we actually use music to treat patients. We use music for melodic intonation therapy. It's so powerful. So the role of music is really at the heart of the interventions that we develop at Hip Hop Public Health. So creating a song is what we do, but how we create it is where the magic is, right? We not only employ science in our messaging, we not only include the symptoms of COVID, for example, we not only leverage certain literary devices, be it repetition, including the most important concepts in the hook of the song. All of these literary devices, all of these music structure devices, we leverage for science. And we also make sure that the messenger, which is hip hop music, is a culturally accepted, beloved phenomenon. In addition, we want to have credible messengers within the videos so that people in those communities can relate to. That's why we get our hip hop artists. We select those we ask to lead some of the music. We select those we include in the videos. So people see themselves in the videos. People understand the language because we use nuanced hip hop lyric. If you listen to even some of the lingo that we use within our songwriting, it's the type of lingo that they use on the streets. And so we really package it for these communities. And because we've done that, and because of our prior success, I just explained stroke, we know that it will resonate with them, and hopefully it will translate into behavior change. And from the reports that we've been receiving from all over this country, in that particular video, it has really not only raised the awareness of the importance of hand washing among those who watch it, but actually motivates them to want to wash their hands. And that's what we do.
It's so great. We're talking with Dr. Olajide Williams. Here's the video.
Public health. All the healthcare workers on the front line. Together, we can make a difference.
What's good, y'all? This is Doug E. Fresh coming at you live and direct. All of y'all out there, I got a couple of things I want to talk to y'all about. Wash your hands, everybody. And everybody, wash your hands.
20 seconds.
Come on, wash your hands, everybody. And everybody, wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
First and foremost, please listen close. Take your time, wash. Use a lot of soap from the front to the back, back to the front. Sing the hook where you at. That's exactly what we want. If you decide to leave, please take heed. Talk a social distance, at least 6 feet. On a bus or the train, riding in your car. The further you're away, then the better off you are. 20 seconds or more. You gotta be able to wash your hands like you never ever washed them before. 20 seconds or more. Don't try to wait, you'll make the greatest mistake. You need to wash them when you enter the door. 20 seconds or more. Take your time, sing a song, spit a rhyme. When you finish, you can put on some gloves. 20 seconds or more. It's very important to wash your hands. You're protecting everybody you love.
Wash your hands, everybody. And everybody, wash your hands.
20 seconds
Come on,
or more.
wash your hands, everybody. And everybody, wash your hands.
20
People
seconds
from
or
the
more.
Midwest, wash your hands. Dirty South, wash your hands.
20 seconds
People
or more.
overseas, wash your hands. And everybody, wash your hands.
Now if you catch a little fever, shortness of breath, slight little cough, you feel it in your chest, you should call your doctor. Doctor know what's best. Don't go running to the hospital cause you could be a threat. The virus is contagious. Listen, they ain't playing. You ain't see the movie, yo, it's kinda like Contagious. Gotta wash hands thoroughly, even sanitize. Open up your eyes, we don't want this thing to rise. Coronavirus.
Don't you get it? Can't you see? We are living in a state of emergency. So wash your hands, save a life, it's only right. And no matter what you're going through, together we can make it right. Come on! Wash your hands, everybody. And everybody, wash your hands.
20 seconds
Come
or
on,
more.
wash your hands, everybody. And everybody, wash your hands.
20
My people
seconds or more.
uptown, wash your hands.
20
People
seconds
from
or
the
more.
East Coast, wash your hands. People from the West Coast, wash your hands. That's right. Epidemic, pandemic, social distance, non-existence. Don't resist this, get gone in an instant. If you miss this, epidemic, pandemic, social distance, non-existence. Don't resist this, get gone in an instant. If you miss this, epidemic, pandemic, social distance, non-existence. Don't resist this, get gone in an instant.
All right, so Dr. Williams, after you've taken us on this high with the video, I got to just come back to skeptical me for a second. There's building public trust in trustworthy things, and then there's recognizing reasons for serious skepticism. A lot of people, particularly in the African American community in this country and globally, have very solid, historically based reasons for skepticism when it comes to big pharma and big government experimentation on their bodies. So how do you, I don't want to say finesse because that sounds sort of propagandistic, but how do you proceed when this is also the African American community, the number one victim group of this disease?
Oh, that's a great point. And you bring it, I call it visions of Tuskegee. Whenever we
Famous
want
medical experimentation went on for years, leaving
the sterilization, the history of criminal activity by the medical community on Black people in this country, it's reprehensible. And the fear, the skepticism is justified.
Give me one sentence or maybe two on Tuskegee for people that don't know what it was.
Tuskegee was when, the U.S. government was conducting syphilis experiments on Black folks, exposing them to the virus, despite the fact that penicillin came along and was capable of curing the disease. They continued to conduct these syphilitic experiments on Blacks, and many of whom went on to have end-stage devastating manifestations of the disease, even though the researchers knew that the treatment was available.
And the treatment, the test went on for decades.
For decades and decades and decades. It is up to us to rebuild that trust. I have to be completely frank with you that I don't think America has done a very good job, especially under the current departing administration, building that trust. In fact, the departing administration has worsened that trust, has expanded the trust deficit by its behaviors and through its actions. So we are in a very challenging environment. And when you consider the power of social media and the ability of social media to give oxygen to whatever conspiracy theories out there, you realize the size and scope of the challenge at hand. We need to identify these vulnerable populations who are skeptical for very good reasons, but we do know how to reach them. And we know that the way to reach them is to include them. The way to reach them is to include them. We embrace at Hip Hop Public Health what the scientific community refers to as community-based participatory research. That is when the community is involved in not only coming up with the research question, helping you design the research strategy, helping you with the implementation of the research product, and then by doing that, sharing in the success of the research by making sure they're included in the press, in the papers. And so one of the things that we have to do is, as we are considering the distribution of this vaccine, we need to make sure we partner with community groups. We need to have them at the table, sending hand in hand with the scientists. Their leaders have to be there, helping to design not only the message, but the communication strategy. That way, the community will say, hey, Pastor Waldron or Pastor Smith was involved. He was at the table when they were developing and designing this process. And that's one way to build trust. We also make sure we need to include people from that community on the scientific side of the fence. So Black physicians, Black scientists, especially those who are notable, Black nurses, Black pharmacists, all of whom are on the scientific side, who are well versed in the science of the vaccine, to say, hey, I received this vaccine and it is safe, and this is why it is safe. Mm-hmm. There needs to be a very deliberate strategy to winning them back.
You raise an important question about confidence. You've seen countries where the public health system is actually public, where private companies play a smaller role, where the public feels like this is their health system. Maybe not perfect, but I certainly grew up in one where people were very proud of their national health system. Can we do this trust thing in a private healthcare environment? For-profit, insurance-based environment?
Well, I mean, you open a whole nother door in my mind, because, I, for one, believe that in its very design, in its fundamentals, the current U.S. health system is unfair. It's an employee-based system. Yes, there is Medicare and Medicaid, wrapped around that, but it's fundamentally an employee-based healthcare system, and that in itself has inequities built in from the beginning. I actually believe that healthcare should be a right, and it should not be a commodity that is bought and sold and traded. It should be a fundamental right, access to high quality healthcare. In the absence of it being a fundamental right, it certainly needs to be affordable. And we're struggling with even the affordability aspect. Let's put aside the rights debate and the rights discussion and move on to the platform of affordability. We're not even there yet. We're not even at the affordability stage yet. And so the healthcare system is a fundamental barrier to a lot of the issues that we are talking about right now, whether it be vaccine distribution and treatment, or even the COVID pandemic that has disproportionately affected certain communities. And so, we need to address these fundamental issues. Now, what typically happens is that Congress will, because of Operation Warp Speed investment in these private companies, Congress might, there might be a way to make these vaccines free. But then you're just putting Band-Aids on the problem because, you're investing billions of these companies to make the vaccine free. Just reimagine how you can make healthcare a right and not a commodity.
All right, so you're leaving me with there are some really amazing people like yourself working in public health, but we have a public health system that is not optimal for public health. Dr. Williams, thank you so much. It's wonderful to talk to you.
Thanks,
Appreciate
Laura.
it.
Thank you so much, Laura. I'm a big fan of yours, so this has been wonderful.
I've really enjoyed it too. Thank you.